Hi everyone. I know everybody's really nervous about the first exam, and once again, I told you not to be if you're doing all your readings and everything, but I also promised that I would go over some few important points. So the biggest thing is we're going to go way back and when to week one. So this is week 1, 2, and 3 for these for this review. So mostly, the most important thing is you have the role of the nurse practitioner as prescriber, which now you are soon to be the prescriber, and exciting but very scary. So you need to know the roles and the responsibilities of the prescriber. So you know about the national guidelines, how all collaboration with other providers and national guidelines is what keeps us out of court. I've said it over and over again. You did the discussion board based on your the case studies, and you all had to look at those national guidelines, which you probably weren't totally fully aware of them until then. The book touches on it a little bit, but it's more important than you know. We're always looking there. So who controls us as nurse practitioners? Who regulates our prescriptive authority? All states, it's the Board of Nursing regulates our practice. So you have to make sure that you know that the IDPR in Illinois, which is our nursing board, also regulates our practice. All states also have title protection for NPs. Someone who's not an NP can't call themselves an NP, although I have somebody that I work with recently who's a CNS who calls herself an NP. I kind of get a little bit offended because we are trained differently. Nothing against the CNS, they're great people, but they are not educated in the same way. They didn't go through the clinical hours that you did. They did them in a different way, based on education and education of other nurses and things like that. So in all states, the title protection for NP, you're not supposed to be able to call yourself an NP if you were not, just like you cannot call yourself a physician if you are not. That's all that means. So once again, State Board of Nursing is who regulates our prescriptive authority. Okay. With that being said, our prescriptive authority based on the state says we cannot write for Schedule 2. So what happens there is your collaborative physician in your collaborative agreement says that you can write for 2s. I write for C2s all the time, which are like your Percocet and drugs like that, fentanyl, things like that. Those are Schedule 2s. So the actual reality of that one is that if it's in your collaborative agreement, which is then sent to the state, you are protected, and you have to make sure that your DEA reflects that you can write for Schedule 2 drugs, because pharmacy is going to pull up your name and it's not going to say that you can, and guess what? You're going to be in trouble, and B, you cannot. Okay, so we need to know the difference for a PA too. What's the difference between the PA? I used to not be really happy with PAs, but I think now they're trained much better. And in some ways, I think they can function better, especially in specialty services, as in ortho and derm. You'll see a lot of PAs. What you need to know about the difference between the PA, of course, the State Board of Nursing doesn't mandate their practice, but the State Board of Medical Examiners does. The difference between us and a PA, they are supervised and you are not. You have your own independent license, even though you have a collaborative agreement. There's a difference between supervision and collaborative. So when you're getting a physician contract, when you're getting a contract from your physician rather, make sure nowhere on there does it say supervised. That's different. That means supervised means your physician has to be present in the building at all times while you're practicing. Collaborative means just what it says, collaborative. You're going to be speaking with that physician about your patients and of course contacting them if there's something you can't handle. Big difference between collaboration and supervision. So you want to make sure you know that. Once again, PAs are controlled by the State Board, the medical examiner, not by a Board of Nursing, obviously. So when you're thinking about clinical judgment in prescribing medications, what do you think you need to know for your clinical judgment? Of course, you're going to make your diagnosis. That's the first part of it. You're going to always make your diagnosis. You're going to try not to find that latest new drug. But what else does it include? What it always should include, first and foremost, you have to worry about the cost to the patient of the medication you're prescribing. Never, never, never think oh my gosh, the insurance will take care of it. Sometimes people's insurance, after insurance, they're paying $100 a month. Most people really can't afford that. $100 a month, just think about it. Most people are on more than 4 medications. That's another issue too. So if each one costs them $100 a month, there'd be a kind of a problem. So you always want to make sure you're factoring in that cost. What is going to be your criteria for choosing the most effective drug? Let me pull this up, clinical judgment and prescribing. What's going to be the most effective drug for the disorder? Hold on 1 second. Sorry about that. Back to clinical judgment and prescribing. So what's your criteria? What's gonna cause you to pick a certain drug for a medication? Say you have a patient that comes in and they're, well, we'll just say for sinusitis. Are you going to pick Cipro for them, or are you going to pick amoxicillin, and why are you going to do that? So what guides us to do that is those national guidelines, right? The protocol. There's actually a protocol for sinusitis, and it starts with amoxicillin, Augmentin, and then to Augmentin, and then to either the fluoroquinolones or something like that. So once again, we're not just picking things out of the air. When you're going to choose a drug for a disorder, you want to always consult those national guidelines. Same with blood pressure medication. Are you going to put somebody on blood pressure medicine anymore when JNC8 comes out that is 120/80 or 130/80? No, you're not, right? If they're over 65, you're going to be consulting those JNC8 guidelines and decide. So those guidelines, that's once again what keeps you out of court, and that's standard of care. So that's the thing. So you've got cost, of course, but the thing that one of the criteria that guides us definitely is those guidelines, those national guidelines. Okay, so during all this healthcare reform, why it was proposed that the nurse practitioners may thrive under this healthcare reform, mostly because we have great ability and we can control costs and improve patient care. So we need to make sure that we're always controlling costs and improving patient care, which also means keeping up on those guidelines and always reading, learning, because you know everything changes. Just a quick blurb about that, not test related. Once January 1 happened and Obamacare or affordable health care kicked in, a lot of the nurse practitioner jobs dwindled away for a few months, and now they're returning, it seems like. I think people were scared about reimbursement and how can they pay us. I think the other thing, we may thrive, our practice may thrive because we do have the ability to control costs and improve patient outcomes. I think it won't be long before we're allowed to have our own practices. And I am actually waiting for that day because I would have more of a holistic practice, more of an integrated health practice dealing with women's health personally. So I always am watching that AANP website. I encourage you all to join AANP. It goes right to your email and phone, all the legislative updates. They'll have you, when something's going before the state, they'll give you the canned letter to send to the state with your signature on it to your actual individual representatives. And I think that's an important thing too. So 2 things I want everybody to do, if you can swing it, is get the paid version for your phone of Epocrates. And I also would like everybody to join the AANP. I think it's super important to be in that professional organization. And by the way, it's on every job application when you're applying to be an NP, so it must be important to other people as well. Okay, back to your review. First pass effect too. I wonder if first pass effect has to do with your bioavailability, your pharmacokinetics, your pharmacodynamics, and I'm going to see, I might just pause right here and see if we can find another PowerPoint with that on it. Okay, see you in just a bit.